vaccine in South Carolina. We'll tell you more about that on WYFF News 4 at 5. Right now, we want to send you to an NBC News special report.
This is an NBC News special report. Here's Lester Holt.
Good afternoon, everyone. We're coming on the air to bring you a briefing at the White House with Press Secretary Jennifer Psaki and President Biden's Chief Medical Advisor, Dr. Anthony Fauci. Let's join it in progress.
About the state of the pandemic, the status of vaccines. He'll take some of your questions. I will play the role of the bad cop when it's time for him to go and get to the work of the American people. And then I will do a topper and I'll answer a bunch of your questions as well. So there's lots to come after this. With that, I will turn it over to Dr. Fauci.
Thank you very much, and I'm going to just spend a couple of minutes just summarizing the status of where we are, and then maybe addressing some of the things that I know are on people's minds. So, first of all, obviously, we are still in a very serious situation. I mean, to have over 400,000 deaths is something that, you know, is unfortunately historic in the very bad sense. When you look at the number of new infections that we have, it's still at a very high rate. Hospitalizations are up. There are certain areas of the country, as I think you're all familiar with, which are really stressed from the standpoint of beds, from the standpoint of the stress on the healthcare system. However, when you look more recently at the 7-day average of cases, remember we were going between 300,000 and 400,000 and 200,000 and 300,000. Right now it looks like it might actually be plateauing in the sense of turning around. Now, there's good news in that, but you have to be careful that we may not be seeing perhaps an artifact of a slowing down following the holidays. So when we see that, we think it's real. But one of the things, and it's interesting, I'm sort of getting a deja vu standing up here because I said something like this almost a little bit less than a year ago when we were talking about the acceleration of cases in the late winter, early spring of 2020, when we were having New York City metropolitan area being the epicenter of what was going on, that there are always lags, so please be aware of that when you have cases and then a couple of weeks later you see it represented in hospitalizations, intensive care, and then a couple of weeks later in deaths. So you have almost a paradoxical curves where you see something plateauing and maybe coming down at the same time as hospitalizations and deaths might actually be going up. So this is something that I just put on your radar screen. It is not an unusual thing to see that sort of thing. The other point I want to make is one that we're getting asked a lot regarding questions, and that is, what is it about these mutants that you're hearing about? The mutants in the UK, which we know are in about 20+ states, the mutants that we're seeing in South Africa and in Brazil. First of all, we need to understand that RNA viruses like coronaviruses mutate all the time. Most of the mutations don't have any physiological relevance with regard to the function of the virus itself. However, every once in a while, you get mutations, either singly or clustered in combinations, which do have an impact. So what have we learned thus far? And I want to emphasize thus far because we're paying very careful attention to this, and we take it very seriously. At least from the experience that our colleagues in the UK have had, the one that is in the UK appears to have a greater degree of transmissibility, about twice as much as what we call the wild-type original virus. The one that is in South Africa is a bit different, and I'll get to that in a second. So it does look like it increases the transmissibility. They say, correctly, on a one-to-one basis, it doesn't seem to make the virus more virulent or have a greater chance of making you seriously ill or killing you. However, we shouldn't be lulled into complacency about that, because if you have a virus that is more transmissible, you're going to get more cases. When you get more cases, you're going to get more hospitalizations. And when you get more hospitalizations, you're ultimately going to get more deaths. So even though the virus on a one-to-one basis isn't more serious, the phenomenon of a more transmissible virus is something that you take seriously. The next thing is, does it change enough to interfere with the efficacy of a whole group of monoclonal antibodies that many of you are aware of. The monoclonal antibodies that are being used for treatment in some cases and prevention. Since monoclonal antibodies bind to a very specific part of the virus, when there's a mutation there, it has much greater a chance of obliterating the efficacy of a monoclonal antibody. And we're seeing in the much more concerning mutations that are in South Africa and in some respects Brazil, which is similar to South Africa, that it is having an effect on the monoclonal antibodies. The real question that people are quite clearly interested in is, what is the impact on the vaccine? And so far, literally, we have this new phenomenon that are preprint journals where people get data and they put it into a preprint server where it hasn't yet been peer reviewed. But you have to pay attention to it because it gives you good information quickly. Ultimately, it gets confirmed. And we're seeing them coming out over the last few days. And what they're saying is that what we likely will be seeing is a diminution, more South Africa than UK. UK is that diminution in what would be the efficacy of the vaccine-induced antibodies. Now, that does not mean that the vaccines will not be effective, and let me explain why. There's a thing called a cushion effect. So if you have a vaccine like the Moderna and the Pfizer vaccine that can suppress the virus at a dilution, let's say, of 1 to 1,000, and the mutant influences it by bringing it down to maybe 1 to 800 or something like that, you're still well above the line of not being effective. So there's that cushion that even though it's diminished somewhat, it still is effective. That's what we're seeing, both certainly with the UK, which is very minimal effect. We're following very carefully the one in South Africa, which is a little bit more concerning, but nonetheless not something that we don't think that we can handle. What is the message? Because someone could say, now wait a minute, if you have the possibility that the vaccines are diminishing in their impact, why are we vaccinating people? No. It is all the more reason why we should be vaccinating as many people as you possibly can. Because as long as the virus is out there replicating, viruses don't mutate unless they replicate. And if you can suppress that by a very good vaccine campaign, then you could actually avoid this deleterious effect that you might get from the mutations. Bottom line, we're paying very close attention to it. There are alternative plans if we ever have to modify the vaccine. That is not something that is a very onerous thing. We can do that given the platforms we have. But right now, from the reports we have, literally as of today, it appears that the vaccines will still be effective against them. With the caveat in mind, you want to pay close attention to it. So, Jim, why don't I just stop there and then maybe just answer some questions on anything else that I said. So, yeah.
How helpful would it have been if Amazon got involved with the federal response to COVID-19 before Biden took office? And do you know about any plans or discussions ahead of yesterday?
No, I don't think I could answer that question. I'd be waving my hands about that, sorry. Well, you know, one of the new things in this administration is if you don't know the answer, don't guess. Just say you don't know the answer. Yeah. Yes.
Dr. Fauci, a couple of questions, if I might. I'd like to follow up with you on what you just said about this strain in South Africa. Has that strain made its way to the United States? And what, if any, concerns do you have? How much do we understand about it?
Great question. Thus far, it does not appear at all that the South African strain is in the United States. However, we must be honest and say that the level of comprehensive sequence surveillance thus far is not at the level that we would have liked. So we're going to be looking very, very carefully for it. But given the information we have today, it doesn't appear that the South African strain is here.
Okay, and if I could just ask you about the effort to distribute the vaccines, because of course that's what most people want to know. When are they going to get a vaccine? Is the Biden administration starting from scratch with the vaccine distribution effort, or are you picking up where the Trump administration left off?
No, I mean, we certainly are not starting from scratch, because there is activity going on in the distribution. But if you look at the plan that the president has put forth about the things that he is going to do, namely get community vaccine centers up, get pharmacies more involved, where appropriate, get the Defense Production Act involved, not only perhaps with getting more vaccine, but even the things you need to get a good vaccine program. For example, needles and syringes that might be more useful in that. So it's taking what's gone on, but amplifying it in a big way.
President Biden said that what was left was abysmal, essentially. I mean, is there anything actionable that you are taking from the previous administration?
Well,
And is that delaying your efforts to get the vaccine? I mean, that's the question.
no, I mean, we're coming in with fresh ideas, but also some ideas that were not bad ideas with the previous administration. You can't say it was absolutely not usable at all. So we are continuing, but you're going to see a real ramping up of it.
One more final question. You had said that most people will be vaccinated by the middle of 2021. Is that still your expectation?
Yes, it is. I mean, I believe that the goal that was set by the president of getting 100 million people vaccinated in the first 100 days is quite a reasonable goal. And when you get to the point, and one of the things that I think is something we need to pay attention to, and I, quite frankly, have been spending a considerable amount of my own time, is outreaching, particularly to minority communities, to make sure that you get them to be vaccinated and you explain why it's so important for themselves, their family, and their community. If we get 70 to 85% of the country vaccinated, let's say by the end of the summer, middle of the summer, I believe by the time we get to the fall, we will be approaching a degree of normality. It's not going to be perfectly normal, but one that I think will take a lot of pressure off the American public.
In fact, you're one of the few holdovers from the previous administration to this current one. What has been your experience with this new team? And in your view, what would have been different in terms of the trajectory of this outbreak from the start had a team like this been in place at the beginning?
Well, I can tell you my impression of what's going on right now. The team, I don't know if I can extrapolate other things, but one of the things that was very clear as recently as about 15 minutes ago when I was with the president is that one of the things that we're going to do is to be completely transparent, open, and honest. If things go wrong, not point fingers, but to correct them, and to make everything we do be based on science and evidence. I mean, that was literally a conversation I had 15 minutes ago with the president, and he has said that multiple times.
Is there anything that you, looking back on your comments over the last 10 or 12 months, would like to now, with that sort of license, to amend or clarify?
No, I mean, I always said everything on the base. That's why I got in trouble sometimes. Right.
Yes. You mentioned pharmacies. The new CDC director said today that the goal of getting vaccinations into pharmacies by the end of next month isn't realistic, as had been previously suggested. When will most Americans be able to get a vaccination in their neighborhood pharmacy?
Well, I didn't hear that comment. Are you talking about Dr. Walensky's comment? I didn't hear that comment, so I don't really want to comment on the comment. But what she may be saying is that for many people in this country who don't have access to a pharmacy, they may not be able to utilize getting things in the pharmacy. I'm not sure. I want to be careful because I'm not sure that's what she said. We just had a conversation about how we're going to get vaccines to people who are in pharmacy desert areas where they don't have easy access to a pharmacy. And that's something we're working on and taking very seriously.
But just to be clear, if you are in an area where you do have access to a CVS or a Walgreens, right, when will you be able to get access to this vaccine like you would a flu vaccine?
You know, in the spirit of not guessing, I really am not quite sure when that will be, but we can get back to you on that.
And just on the broader timeline, you mentioned the fall. We just heard the president say, you know, the brutal truth is that it is going to be several more months. Just to be clear, you're saying by the fall, the majority of Americans you think will be vaccinated?
No, I didn't say that. I said if we get the majority of Americans, 70 to 85% vaccinated by then, we could have a degree of herd immunity that would get us back to normal. The concern I have, and something we're working on, is getting people who have vaccine hesitancy who don't want to get vaccinated, because many people are skeptical about that. So we really need to do a lot of good outreach for that. I mean, I don't know what the best case scenario for me is that we'd get 85% of the people vaccinated by the end of the summer. If we do, then by the time we get to the fall, I think we can approach a degree of normality.
On the mutations that you were talking about, a question about how exactly they increase transmissibility. Does it take less exposure time to get?
No. What it is that you can do in vitro in a test tube setting, binding an affinity to the receptors which you have in your nose, in your lung, and in your GI tract. The receptor for the virus is called an ACE2 receptor, and the facility or affinity with which a virus binds to that means that it very likely will have a better efficiency of infection and replicate more in the nasopharynx. So that's how you make that determination in the test tube. Then you look epidemiologically and you see a spike going up in the sense of number of cases, and they sort of match each other. A virus that has the ability to easily bind to and replicate with your receptors is one that likely will spread easier.
So it doesn't mean that you'd have more viral load?
Well, you could, yes. In fact, it would mean, because if it binds more easily, it could replicate in the nasopharynx more easily, and it is likely that you would have a higher viral load.
Does it make masks less effective in that case?
No, it makes it the reason why you absolutely should be wearing a mask. It doesn't necessarily make it less effective. If you properly wear a mask, then you'll be okay.
And on the UK strain, do you have any data on how widespread that strain is in the United States?
Well, I think it's in at least 20 states that people have mentioned exactly. The real question that's going to be asked, is it going to become the dominant strain, or will the strains we already have prevent it from flourishing and being the more dominant strain? But it is here for sure. Yeah.
Just a follow-up on vaccines. Some state and local authorities are saying that they would be able to distribute more vaccines if they had more. Is the Biden administration now trying to increase production by Moderna and Pfizer in the next 6 weeks?
Yeah, as well as to utilize what we hope will be another player in the field, the J&J, Janssen, as well as other of the companies. But also, as the president has said in his plan, to do whatever he can to expand the availability of vaccines, whatever that is. I mean, he said that he's going to just use every possibility, including the Defense Production Act.
And can you explain the discrepancy between what some states are saying about needing more vaccines and the CDC saying that a lot of vaccine is still remaining on people's or on their shelves?
Yeah, you know, I think that is something that we need to really take a close look at, because that is sort of an inconsistent discrepancy. And then one of the things we want to do is to find out why that's the case. And if it is the case, particularly the thing that would be most disturbing, if there's vaccine laying around and people are not using it when others would need it. But I don't know the answer to that question, but we need to look into it.
Dr. Fauci, you've joked a couple times today already about the difference that you feel in being kind of the spokesperson for this issue in this administration versus the previous one. Can you talk a little bit about how much different do you feel, less constrained? What is the, I mean, you for so many times you stood up behind the podium with Donald Trump standing behind you. That was a different feeling, I'm sure, than it is today. Can you talk a little bit about how you feel kind of released from what you had been doing for the last year?
Yeah, but you said I was joking about it. I was very serious about it. I wasn't joking. No, actually, I mean, obviously, I don't want to be going back over history, but it was very clear that there were things that were said, be it regarding things like hydroxychloroquine and other things like that, that really was uncomfortable because they were not based on scientific fact. I can tell you, I take no pleasure at all in being in a situation of contradicting the president. So it was really something that you didn't feel that you could actually say something and there wouldn't be any repercussions about it. The idea that you can get up here and talk about what you know, what the evidence, what the science is, and no, that's it. Let the science speak. It is somewhat of a liberating feeling.
I mean, you were basically banished for a few months there for a while. You feel like you're back now?
I think so.
Well,
Okay.
that's Mike Shear. If you don't want to take questions from him, you can. Thank you, Dr. Fauci, so much for joining us. We really appreciate it, and we'll have him back again. So thank you. Well, thank you, everyone. As I promised, we'll have a full briefing from here. So, as you know, just a few moments ago, the President also released a national COVID-19 strategy and signed 10 executive orders and other directives to move quickly to contain the crisis. Underpinning everything the President signed today and everything we do every day will be equity. Some highlights of those actions include an executive order to fill supply shortfalls for vaccinations, testing, and PPE. The President directed agencies to exercise all appropriate authorities, including the Defense Production Act, to accelerate manufacturing and delivering of supplies such as N95, masks, gowns, gloves, PCR swabs, test reagents, and necessary equipment and material for the vaccine. The President also signed a presidential memorandum to increase federal reimbursement to states and tribes for the cost of National Guard personnel, emergency supplies, and the personnel and equipment needed to create vaccination centers. An executive order that established a COVID-19 pandemic testing board to bring the full force of the federal government's expertise to expanding testing supply and increasing access to testing. An executive order to bolster access to COVID-19 treatments and clinical care, establishing a comprehensive and coordinated preclinical drug discovery and development program to allow therapeutics to be evaluated and developed in response to pandemic threats. Sorry, I had to clear my throat. There's a lot here. He also issued an executive order directing the Departments of Education and Health and Human Services to provide guidance on safe reopening and operating for schools, child care providers, and institutions of higher education. An executive order on the Occupational Safety and Health Administration to immediately release clear guidance for employers to help keep workers safe from COVID-19 exposure. An executive order to require mask wearing in airports or certain modes of public transportation, including many trains, airplanes, maritime vessels, and intercity buses. And an executive order establishing a COVID-19 health equity task force, something we had previously announced, but making it official today, to provide specific recommendations to the President for allocating resources and funding in communities with inequities in COVID-19 outcomes by race, ethnicity, geography, disability, and other considerations. These steps, of course, build on the actions we announced yesterday. I had an additional update. Some of you may have seen this come out through late last night, but I wanted to share with you that as a result of one of the executive orders President Biden signed yesterday, the acting Homeland Security Secretary issued a memorandum to review and reset immigration enforcement priorities. For 100 days, beginning tomorrow, the Department of Homeland Security will pause removals for certain individuals. This pause will allow the administration to review and reset enforcement policies and ensure that resources are dedicated to the most pressing challenges and that we have a fair and effective enforcement system rooted in responsibly managing the border and protecting our national security and public safety. I had one other item I just wanted to flag for you about something the First Lady is up to. Let me see if I can find that, or I will circle back to it a little bit later. With that, I'm happy to take your questions. Zeke, why don't you kick us off?
Thanks, Jen. There was some reporting earlier today about the President's commitment to extending New START. Can you talk about what the President's directive on that front has been? Additionally, can you confirm that the President requested reports from the new DNI for an assessment on potential foreign interference in the 2020 election, and then also the SolarWinds Act?
I can confirm that the United States intends to seek a 5-year extension of New START as the treaty permits. The President has long been clear that the New START treaty is in the national security interests of the United States. And this extension makes even more sense when the relationship with Russia is adversarial, as it is at this time. New START is the only remaining treaty constraining Russian nuclear forces and is an anchor of strategic stability between our two countries. And to the other part of your question, Even as we work with Russia to advance U.S. interests, so too we work to hold Russia to account for its reckless and adversarial actions. And to this end, the President is also issuing a tasking to the intelligence community for its full assessment of the SolarWinds cyber breach, Russian interference in the 2020 election, its use of chemical weapons against opposition leader Alexei Navalny, and the alleged bounties on U.S. soldiers in Afghanistan. So that's hopefully answered all of it. That was a mouthful.
And just changing gears for a quick second to COVID.
We are listening in on a news conference. That's Jen Psaki, the new press secretary for the Biden administration. She will become quite familiar in the days ahead to news viewers as this administration resumes the idea of daily press briefings. Fair amount of news, though, made at the beginning of this by Dr. Anthony Fauci talking about these variants we've been watching very closely, the UK one and the one that he seems to think is more troublesome, a South African variant that they don't believe is in the U.S. right now, but could somewhat diminish the effectiveness of the vaccine. Before I get a little too far over my skis, let me bring in Dr. John Torres, NBC News medical correspondent. Dr. John, did I frame that correctly?
You did frame it correctly, Lester. And what he was basically saying is we're looking at the UK variant, we're looking at the South African variant, which is fairly close to the Brazil variant. And he's saying with the UK variant, we know that it can cause people to be more contagious. They can catch and spread the disease easier, but it doesn't appear to be more, the word he used was virulent, meaning it doesn't appear to be more deadly, but it is a numbers game. So the more people that get it, the more people are going to have effects and even die from it. And so he warned about that. But then he switched to the South African variant. And he said there, it's a little more worrisome because we're actually looking at that and finding that with monoclonal antibodies, which is one of the treatments we have, they don't seem to be as effective with this variant out of South Africa, but they haven't detected that variant here in the U.S. yet. And then he went on to talk about vaccines. He said that the vaccine, and the bottom line he used is, as of today, it appears the vaccine is effective against it. And he said that's mainly because of what they call the cushion effect. In other words, the vaccine works so well that 95% effectiveness, they can get that down a little bit and the vaccine will still work fairly well. So he's saying even though it doesn't work as well against the South African variant, it's still going to work against the South African variant. We just don't know to what degree, but we think to degree enough that we can get things under control. But Lester, I do have to tell you, one of the most enlightening things I think we heard is the fact that he was talking more freely. He mentioned what happened back with the prior administration, particularly with hydroxychloroquine, and how that wasn't based on science and he wasn't able to say anything. And now he feels like he can say these things that we think are important, at least in the medical community, Lester.
Yeah, he certainly seemed to have a degree of greater freedom in his comments. Doctor, thank you. Let me bring in Tom Costello, who's been covering the vaccine rollout for us. Tom, Dr. Fauci mentioned this Johnson & Johnson vaccine that appears to be rather close. What can you tell us about that?
Yeah, that's right. We expect an announcement could come as soon as the next week or two, suggesting that the Johnson & Johnson data on their stage 3 clinical trials is positive, and in fact that they be ready to go ahead with a request for emergency FDA authorization, or emergency use authorization. So that could happen within just a matter of weeks now. And the nice thing about the Johnson & Johnson vaccine, if and when it becomes available, is that it's a single shot. You know, the Pfizer vaccine and the Moderna vaccine, which are now out there, require the initial vaccine and then the booster shot. Johnson & Johnson would only require the single shot. And I'll tell you another item that's being discussed right now in medical circles across the country and among top researchers. You know, if we're having trouble getting these doses into arms, and we are, there's a significant bottleneck, can you forego the booster shot? Can you just go with the initial vaccine for now and wait weeks or months before the booster shot would be given? And there is some new thinking that that may be possible, that maybe you don't need to give that booster shot within 2 to 3 weeks. Maybe you can wait weeks or months to give the booster shot, and therefore you'd free up more vaccine and you'd be able to get more people vaccinated. There's nothing definitive on that yet because, as you know, this entire episode with the coronavirus and the vaccines, we're kind of living this test as we go along, right? We're learning as we go. But that is one area that they're now considering. Maybe they can wait on the booster shot for the Moderna and the Pfizer vaccine. That's one area of research they're working on.
All right, Tom, thanks very much. I want to bring in White House correspondent Jeff Bennett. Jeff, to say that this administration is getting off to a very busy start is probably an understatement.
I think that's a fair assessment, Lester. And look, President Biden today fulfilling a key campaign commitment on his first full day in office, unveiling a battle plan to combat the coronavirus and signing 10 executive actions to boost vaccination accessibility, to boost testing, to bring about a national school reopening plan that will safely reopen schools. We heard Dr. Fauci in that briefing today. He said that he views it as entirely reasonable, President Biden's plan to have 100 million shots in arms, as he so often says, within the first 100 days of his presidency. That is a goal that has been complicated by the situation that President Biden says he inherited from the last administration. He said that the vaccination plan that President Trump left for him is a dismal failure, to use the phrase. And so now President Biden is hoping to use the Defense Production Act, which is a 1950s era law that effectively compels private companies to produce whatever items are needed for the public good. So in this case, that would be more raw materials to make more vaccine, to make more PPE so that the people administering the vaccine can do it safely, to make more syringes, anything that would be needed to get those vaccines off a factory floor into a truck, and from that truck basically into someone's arm. So it's a Herculean task right now sitting before Joe Biden and also Dr. Fauci. Let's not forget, I think what was particularly noteworthy about everything that he said is that Dr. Fauci, who is now Joe Biden's chief medical advisor, is the only Biden official who has the perspective of having worked in the Trump task force as well, the Trump COVID task force. And so now he brings all of that experience and all of the issues that they really came up against and had to deal with now into the Biden White House. Lester.
All right, Jeff Bennett, thanks very much. And we should note the president did speak a little earlier today as he signed some of these executive orders, and he did remind us that he believes things will get worse before they get better. He noted that the number of deaths could likely top 500,000 by next month. Grim stuff. I'm Lester Holt in New York. I'll see you this evening with a complete wrap-up of President Biden's first full day in office coming up on NBC Nightly News. For now, good day, everyone.
And you have been listening to an NBC News special report. We heard